Meanwhile, we also have Dr. Lakshmikant Rathi. He's the president of the Indian Psychiatric Society. Thank you very much for joining us on the telecast, Dr. Rathi. And my first question, of course, talking about the NewsX campaign that has gained quite the traction about an appeal to the Indian Medical Association, the Health Ministry, the ICMR to conduct India's largest ever psychological study into the mindsets of rapists. Now, would you be willing to extend your support and your organization support to this campaign?
Yes, I will be definitely willing to extend help to this campaign in the capacity of the president of Indian Psychiatric Society also, because mindset and mental health is very important in such incidences which are happening nowadays. So I think if we focus on them, this will be definitely helpful.
How do you think the profiling of rapists and studying their mindsets will help the law enforcement agencies in our country?
I think if we keep the profiling also, we can be knowing that which people are there who are more prone to do such crimes. If we take their records, for example, I feel that many people are having psychopathic minds in the beginning. I also feel that along with this keeping records of screening should also be done as we do for the physical health. For example, some traits are in the beginning since like school days. For example, stealing, lying, gambling, prostitution, increased use of porn, and addiction. These are the things which are giving rise to such crimes in the society much more. So I think this profiling of these characters, trait characters or personality traits, and there should be a screening also along with this, and there should be a lot of mental health awareness also if you want to remove this from the roots from this kind, which are the reasons because of which the person does it. I think definitely brain mapping, mind reading, involving mental health professionals in this will definitely work or help a lot to remove this problem.
How do you think the Indian Psychiatric Society can take this forward? How would you be able to help? And what is it that you require from the government to help you in this campaign?
First of all, as we have been always telling, that fund allocation is as such not much as there is for the physical health, for the mental health. Gradually it is increasing. We feel that this fund allocation should be increased, for which whatever told you, this can be done. Because as such, the IPS has got psychiatrists all over the India, in some few villages also. So if such screening camps are done, where the people are analyzed as they have been analyzed, as we measure our BP or cardiac test. Similarly, mental health status has to be analyzed, and it can be done to the psychologists, social workers, clinical psychologists, mental health, other professionals. And the people who are vulnerable to such crimes can be identified. And when they are identified earlier, as the medical science always tells, the prevention is better than cure, then probably their counseling can be done. They should be taught about the self-discipline. One more thing which I would like to tell this recently, that moral values are to be taught right from the beginning, from the school days. When I was a student, there was a subject called as moral science, which used to tell you what is the value of discipline, what is the value of education, what is the value of parents, teachers, and how one can self-restrain and keep some control on his undesired behavior. And I feel this is a requirement of the day. If such things are taught from the beginning, then definitely it will help. Secondly, government can help us in spreading the mental health awareness in public, because more and more mental health awareness will spread to the district hospitals, their district officers, keeping everywhere, training camps for them, in which Indian Psychiatric Society will definitely be helping to do that. We have recently launched a suicidal helpline also for the public, where people can contact us on this. Like that, if any specific requirement comes from the government, then also in that capacity, we would like to fulfill that requirement also.
On our channel, we also got a number of FBI researchers and special agents who have conducted such similar studies, which have shown massive impact in understanding the motives of the criminals and developing patterns, and thereby nabbing these criminals and ensuring that such acts are prevented. And like I said, you know, you're actually apprehending the culprit even before he acts and rapes an individual. Do you think these individuals, these researchers, teams from the FBI can be roped in and brought to India?
Definitely, when already the studies are done and they have shown the results, they can be done. Only the context has to be changed because our cultural context is a little different from this, theirs. So I think we will have to do it on a more regional languages, regional basis, because most of our population is also not highly educated. So we will have to change it a little bit as we change many of the psychological testing taken out from the Western countries so that they get adapted to our Indian culture. And similarly, if the studies are taken and adapted to our Indian culture and done in our Indian environment by our Indian scientists, I feel definitely this will help in controlling or at least trailing or these people who are more prone to give rise to such crimes.
Do you feel that brain mapping techniques can also be used to conduct such studies?
Actually, brain mapping techniques is usually already being used for the treatment purposes. For example, as a psychiatrist do electroencephalography and brain mapping of the people who are suffering from mental health illnesses. Actually, mental health illnesses, insanity is not equivalent. Hardly there are 5 to 10% of cases. Brain mapping and electroencephalography, as we do ECG of heart, has shown many changes for people who are suffering from minor illnesses like anxiety, depression, which is very common, and as far as stress also. So this can definitely give us an idea about the mental state of the patient. For example, it has got alpha, beta, theta, delta waves. Alpha denominates relaxed person, beta denominates in anxiety people. Like that, definitely, as it helps in patient's treatment also, this can definitely help in recognizing and all the people who might be having some abnormalities at the mental health level, which make them more prone to commit such crimes. I feel that studies as FDA has done, we can also go ahead with that, and it will be useful in my opinion.
Can this exercise be performed annually in the future so that the findings which can be made public are periodically accurate and updated?
Yes, it will be a very good idea because anything required does not give you a result instantly. All about the study requires a follow-up. And similarly, whatever we will be learning out of these exercises when the end results come, and we will be collaborating it along with the other global agencies also, I think this will definitely help us because these problems are not related to any one country or anything. These problems are more or less of addictions, and all these are becoming a globally problem for this. And I will say definitely these two things are very, very much behind this crime, this creating such crimes, addiction as well as pornography use a lot. So definitely timely profiling of this, timely follow up this, and timely making required corrections in these programs will definitely help us to have a better society, having a good mental health components, so that these incidences which are troubling everybody will definitely diminish in future.
Now, what other suggestions do you think can be made as far as profiling of rapists is considered in our country? I think
first is that the record should be kept. I'm not aware how many times they have done this crime, in which situation they have done this crime. I think definitely if one is doing it again and again, and we keep the records of the people who commit murders and all that, somebody has done 1, 2, 3. Similarly, the record of this person should be definitely kept so that once they commit the crime, if they are properly followed up, then there will be chances that they will not be able to commit those crimes again. So it will definitely help us to identify these people, keep a watch on these people, and if you do this from all the angles, then definitely this will help us to reduce this all this hateful crimes, we can say, from the society.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.